Hi, and welcome to Community Analysis of the City of Orlando by myself, Asiya Khan, from my Community Health Nursing Theory class. Historical overview. The City of Orlando is known as the City Beautiful and often referred to as the theme park capital of the world. Prior to European settlers in 1936, the Orlando region was inhabited by a few Native American tribes. In the 1800s to the 1900s, the cattle and citrus industry helped create a future for the City of Orlando. The biggest event, however, to shape the city was the creation of Walt Disney World in 1971. Orlando is now famous for its many theme parks, including Walt Disney World and Universal Studios, as well as natural attractions such as springs and nature preserves. Orlando is the fifth largest city in Florida, hosting over 51 million tourists annually. The population today is over 238,000 with a population density of 2,564 per square mile. The structure of Orlando. There are varying neighborhoods. Some housing communities have older historic homes and others have newer development with two-story homes. There is also an abundance of townhomes and apartment buildings scattered throughout the city, as well as mobile homes. However, there has been a shortage of affordable housing for low-income households in Orange County. There is a mixture as well of residential and commercial areas within Orlando's, and the older neighborhoods have much more trees and larger lots, whereas the newer homes have little backyard. Parks and recreation. The parks network within Orlando is extensive and well maintained, providing space for recreational activities for all ages. This network also includes state parks, the growing number of hiking and bike trails that provide safe traffic areas for the residents. In addition, there are YMCA centers throughout the city. There's many arts and sports centers within Orlando. To name a few, we have Dr. Phillips Performing Arts Center, Camping World Stadium, Orlando Soccer Stadium, Sports Entertainment Complex, Amway, which is home to Orlando Magics and the Orlando Solar Bears. And for kids, you have Orlando Science Center, the Children Repertory Theater, and the Central Florida Zoo. Schools. The K through 12 school district offers innovative magnet programs. They also offer advanced placement and dual enrollment and STEM and robotics, as well as unique art schools and personalized learning approaches. Colleges and universities. The Orlando region offers more than 35 colleges, universities, technical schools, and private institutions. The University of Central Florida is the second largest university within the nation, offering over 200 degree programs to more than 60,000 students. Rollins College, its Croomer Graduate School, has been named among the top MBA programs within the nation. Other unique colleges include Beacon College, the first higher education institution in the country to award bachelor's degree exclusively to the students with learning disabilities. Hospitals. Orlando is home to several distinguished hospitals that are ranked top in the nation, as well as a Level 1 trauma center, 9 selected teaching hospital, and the University of Central Florida College of Medicine. Florida Hospital, along with Orlando Health, Lakeside Behavioral Health Care, and the Florida Department of Health in Orange County, formed the Central Florida Community Benefit Collaboration. This is the first ever multi-hospital public health department joint community team created for the purpose of planning interventions relevant to the community. These organizations and individuals remain committed to serving Central Florida during the economic and healthcare challenges. The population of the community. As of 2012, approximately 250,000 people reside within the city of Orlando. More than half of the residents are between ages 25 to 64, and approximately half of the residents are male and half are female. Majority of residents self-identify as white, and almost a third of the population are Hispanic. Two of the most prevalent diseases identified based on hospital utilization, incidence, prevalence, the death rate within the city are heart disease and cancer. Together, heart disease and cerebrovascular disease are the costliest health problems. According to a report from American Heart Association in 2010, nationally, more than $500 billion are used in healthcare services related expenses, including medication, which are due to heart disease and cerebrovascular disease. Diabetes being the most prevalent chronic disease within the city and leading cause of death within the city affects almost 200,000 residents at a 9.9% rate. This is higher than the Healthy People 2020 goal of 7.7%. Obesity being a contributive factor for both cancer and heart disease needs more focus and interventions citywide. These interventions will also play an integral part in reducing the incidence of other chronic diseases such as diabetes. Many cancers also have effective screening tools and can aid in finding cancer early, so the appropriate treatments can be utilized. However, majority of the minority population are less likely to be screened, partly due to the lack of education. This can also be a contributing factor for higher rates of cancer deaths found in non-white persons. Health-related resources and availability. The Orange County Health Department offers the neighborhood centers to provide health screens and health education, along with counseling and support for families with chronic and acute health problems. They also provide counseling and interventions for individuals who are experiencing crisis situation and life stressors. So we have community objectives. The first one is to increase the percentage of Orlando's residents at a healthy rate. According to the CDC, chronic diseases are the leading cause of death and disability within the United States, as in Orlando. The lack of physical activity, poor nutrition are major contributors to the leading chronic diseases. The percentage of adults who are obese increased during the past 3 years and are over 26% of the population. According to the Healthy People 2020, many cancers can be prevented by reducing risk factors such as tobacco use, physical inactivity, poor nutrition, obesity, and exposure to UV light. By implementing a community-sponsored health coach program for residents that meet chronic condition, we would be able to decrease the prevalence of obesity within Orange County. Increase access to primary care. This would include affordability of care and access to appropriate level care utilizing care navigation and coordination. The Healthy People 2020 national health target is to increase the proportion of people with health insurance to 100%. Many small businesses are unable to offer health insurance to employees due to the rising health insurance premiums. Also, to develop outreach programs to target those at greatest risk for depression within the population. Minorities within Orlando have a slightly lower than average household income and have lower rates of education attainment, and are less likely to have health insurance coverage. These factors are considered social stressors that may contribute to the higher levels of depression and anxiety in minority. Environment. According to the U.S. Bureau of Labor Statistics, 3% of Orlando's residents were unemployed as of January 2018, which continues to be below the national average of 4.5%. A key economic indicator of success of the community is unemployment rate. A high unemployment rate affects healthcare access, creates mental stress, and places a strain on social support systems, as more unemployed persons would qualify for benefits. Similar to other counties in the nation, Orange County have too many fast food restaurants and too few grocery stores. Research has shown this to be a barrier to maintaining a healthy lifestyle, especially within lower income neighborhoods. The age-adjusted death rate due to motor vehicle accident have increased, but it is still below the 2020 Healthy People 2020 target of 12.4 within 100,000 persons. Public transportation and carpooling are not widely used within Orlando. This would help to reduce traffic congestion, motor vehicle collisions, fuel consumption, and air pollution in the city. Government and public policy. Housing affordability. The Impact Homelessness Fund is a $6 million project of the Community Foundation. They've worked collectively with the city to break the cycle of chronic homelessness by building transitional housing with the Housing First model, as housing affordability remains a challenge for the city. Drug abuse. To focus on the growing heroin problem, Mayor Jacobs have formed the Orange County Heroin Task Force in 2015. The task force, in addition to increasing bond and trafficking penalties, have launched a targeted media educating young people about the dangers of heroin, as well as training healthcare workers to treat the addiction. And then we have our prioritized nursing diagnosis, education. The Florida Department of Education reported 80.3% of Orange County have high school students graduated within 4 years of their first ninth grade enrollment. This is below the Healthy People 2020 target of 82.4%. Adults with limited education levels are more likely to be unemployed, on government assistance, or unfortunately involved in crime. Access to primary care. People with health insurance may not be able to afford medical treatment or prescription drugs, so the biggest barrier is the lack of insurance coverage. They are also less likely to get routine checkups and screenings, so if they do become ill, they will not seek treatment until the condition has worsened, making it more difficult and costly to treat. There is also a need to educate our community on health resources available. Promoting healthy weight. The percentage of obese adults is the indicator of overall health of the community. Obesity increases the risk of many diseases and health conditions, including heart disease, type 2 diabetes, cancer, hypertension, stroke, liver and gallbladder disease, as well as respiratory and problems and osteoarthritis. Mental health. There are not sufficient mental health and substance abuse providers to meet the growing need for services. Additionally, there is a lack of social and emotional support services to ensure compliance of these patients. Affordable housing. Housing affordability remains a challenge as the city continues to grow and modernize. The city needs to work with the community during the process of gentrification so the needs of lower income classes are not ignored. Transportation. The age-adjusted death rate due to motor vehicle accidents collision have increased. The increased use of safety belt and reduction of driving while impaired are two of the most effective means to reduce the risk of serious injury and death from motor vehicle crashes. And that's the end. Thank you so much for listening to my presentation.